and welcome to Health Live at Seniors Today. We are delighted to inform you that we have this month, June of 2025, we complete 5 years of the health webinar series, and we've dedicated ourselves to providing you authentic, accurate information from our galaxy of doctors who have been there with us through the last 240 plus sessions that we've conducted. And we're delighted that today we have Dr. Paritosh Baghel. Dr. Paritosh Baghel is working with the Fortis, the SL Raheja Hospital, which is part of the Fortis group. Dr. Baghel has completed his MBBS from the Grant Medical College and Sir JJ Group of Hospitals in Mumbai, and he's done his MD in medicine from the GS Medical College as his KEM hospital, and has expertise in blood pressure, diabetology, general checkup, hypertension, infectious diseases. And today we've invited him to speak about a topic that is perhaps very simple to read, which is cough, cold, given the rains. But the fact of the matter is that the rains are upon us. Depending on which part of the country you are in, there are some places where there are torrential rains, some places where there's a dry spell. But however, the fact of the matter is that it is something which is impacting us all. It's also important to take care of rain-related ailments, because that often is the beginning of more that could happen to the human body, and especially for seniors. With this as the intent, we invited Dr. Paritosh Baghel to take this session. He will be making a presentation. As always, do note that the session is advisory in nature. If you do have any specific clinical queries, then you must speak to a medical professional yourself, visit her or him, or of course you can also connect with Dr. Paritosh Baghel at the SL Raheja Hospital and connect with him. In the meantime, you can don't need to take notes, because this is being recorded and it will be up on the on our Seniors Today website on Monday evening, along with the takeaways, which, as always, is the takeaways are written by a qualified medical practitioner. Over to you, Dr. Baghel, and we will come to you with the questions after your presentation is over. Thank you.
Thank you so much. Thank you, Maheshwari ji. It's a pleasure for me to be here on this in this webinar on Seniors Today. I'm very glad to be a part of this to create an awareness among, and since we know the topic is on cough and cold and mainly monsoon, so my topic is going to revolve around it. Although my presentation does mention about all the monsoon illnesses. So we will start. Can you see my presentation?
No, I can't see it now. You'll need to, yeah, I think it's coming on now.
Yeah.
Yeah. Can
Okay.
you make it full screen?
Yeah, it is full screen.
No, we can still see this. Now it's full screen. Right. Thank you.
Yeah. So thank you for the kind, words and kind introduction. I am associated with Raheja Hospital as a consultant physician. And so I look at internal medicine cases, and monsoon illnesses do come into that area where, it is very common as the monsoons begin. It's just not the fun part, but it also brings with it a lot of diseases, a lot of illnesses, and which can be life-threatening. Not just simple, cold, cough, flu, which we generally see as a majority of the cases, but yes, they can be life-threatening as well. So let us go through it. To begin with, when we say that it's a viral fever, so people say that with monsoons comes fever, and most of the times it has been called that it is a viral fever. Well, to tell you that the fever is a symptom. It's not an illness. It's not a disease per se. It is a symptom which comes when you are having some infection or an inflammation, or it can occur after a trauma as well. So fever is a symptom, not an illness. It is a response of the body when body goes through something, either an infection or an inflammation. So a fever can be, classified into as a medical professional. We see that, fever, or there's a history of fever. The fever can be classified into various types, and according to the duration of the fever, we classify them as acute, subacute, and chronic. And on that basis, we can find out what is the organism involved. We can, get the differential diagnosis, understand which organisms can cause fever, because there are certain infections or certain diseases which can cause fever for a long period of time. For example, tuberculosis, which can lead to fever for months together, typhoid, which can cause fever for months together, whereas certain infections which are very acute, like for example, common cold, cough, or any malarial infections, they lead to acute fever where the fever is short duration. So fever is classified as acute when it lasts less than 7 days, and the person comes with a history which is 7 days old, and below than that or lesser than that, then that is what we call as an acute onset of fever. If it is more than more than 7 and up to 14 days, it belongs to a category of subacute fever. Or if it lasts for more than 14 days, then it is generally called as chronic or persistent fever. And at the same time, there is also a condition where there could be fever for weeks together and with no explanation. And that is time when we call it as fever of unknown origin. So there are so many causes of fever, and not only fever, there's associated symptoms with fever. So it can be infection or it can be inflammation. It could be because of some disease process like malignancy. It can also be associated with drugs or some immune mediated disorders, endocrine disorders, or sometimes it could be self-induced fever. So when we talk about monsoon diseases, although we're going to talk on cough, cold related fever, and especially in the monsoons, monsoon diseases can be classified fairly into these four groups, where they are airborne diseases, there could be waterborne diseases, there could be vector-borne diseases, and skin diseases, which are common during this monsoon season. And common cold or flu, which we generally call in our layman terms as flu, which is an influenza infection. These are generally clubbed as viral fever, because the most common cause for fever in this monsoon, and that too, which is airborne and leads to respiratory symptoms, is generally called as viral fever. That is where what we say, that when we say viral fever, it is generally, a respiratory infection or affecting our joints and causing high grade to moderate grade fever. That is what we call as a viral fever. Whereas there could be other causes of fevers in monsoons, which can be because of certain other organisms, and there could be other routes by which we get these diseases. So they are classified according to the route by which we get the infection. So there are airborne diseases, there are waterborne diseases, there are vector-borne diseases, and there could be skin diseases which are seen. So why do we classify them as airborne diseases? Generally, respiratory infections, which are the common cause for cold, cough in this season or any time of the season. They are spread through air. The vehicle is transmitted, the organism or the virus, which is transmitted through the air by a droplet, which is spread because of a sneeze or a cough. And that's why it is called airborne. So these droplets, which contain these viruses or the organisms, when we cough, they are spread over a distance. And when you come in close contact with any of the person who's having this, who's carrying this infection or these viruses, he coughs or sneezes, and when you come in contact with them, you can get that infection, and that is how the disease is spread. And the most common diseases which are spread by this route are common cold, which is again a viral infection, influenza, which is a specific viral infection, which is the influenza virus, and various other respiratory diseases, like how we are hearing about is COVID. Then there is H3N1, all those various influenza viruses, SARS viruses, and all that. So most of the respiratory infections are spread by airborne route. And viral disease, as we can see, the flu, which is the most common form of infection in monsoons, is common disease all over the world, but during monsoon it becomes more prevalent. And if you get wet and you are exposed to a person who's been coughing or sneezing, very likely that you are going to get that infection. Constant sneezing, sore throat, and fever are the most common symptoms of this disease. So generally, viral infections can cause a variety of symptoms, the common being fever, sneezing, sore throat, and a severe amount of fatigue and malaise and weakness. That is a classical symptom of any viral infection affecting the respiratory tract. Although they are not very specific symptoms, they can be associated with other infections also. But these are some of the common symptoms which are associated with the flu or the viral flu. They begin with fatigue, weakness, malaise, and then you start getting the respiratory symptoms, which is sneezing, sore throat, and cough. Generally, when we see these patients with flu, we generally ask that to start with preventive measures to begin with, and household remedies in terms of avoiding cold food, cold drinks, or preventing contact with other people. But there are times when we need to give antiviral treatment, and it's recommended, especially in people who are prone to become more sick, or those who are prone to develop a severe disease with these viral infections. Most of the individuals who have a good immunity generally recover in the next 3 to 5 days of the symptoms. And those who have got low immunity in terms, especially at the extremes of age, children, or pediatric group infants, and the elderly population, especially more than 60 or 65. And in those people who have got an underlying disease like a liver disease, kidney disease, or heart disease, or those who have got diabetes, they are having low immunity, and that makes them prone for a severe infection, even though most of the time the flu can be a mild disease. Such patients or such individuals who are at a higher risk of severe infections are advised to start treatment. They may be hospitalized, or they may be started with a particular drug, which is antiviral, which you would have heard about, which is Tamiflu, which is approved by the FDA, and it has to be started in patients immediately within 2 days of illness at the onset of symptoms. And it is recommended for people with underlying comorbid conditions, not for everyone. As I tell you, most of the people recover without any antiviral treatment. Again, there is a big thing which we see in our practice, that most of the patients who have visited their doctors over there, they immediately start with antibiotics, which absolutely I would, we tell all the doctors whenever we are talking to doctors as well as to patients, the most important thing is not to start antibiotics, because the initial infection of flu or the viral infections, antibiotics do not work in that. Antibiotics are for bacterial infections. So most important thing, never pop an antibiotic immediately after you get some fever. You find the cause. If it is viral infection, then any which ways this antibiotic is not going to work. In fact, it may lead to more antibiotic resistance, and it may lead to side effects associated with the use of antibiotics. So first and foremost, prevent the spread of infections, avoid close contact with people who are sick. When you are sick, keep the safe distance, stay home, preferably stay away from your family members also, because this being a respiratory bone or airborne infection, it can easily spread from person to person. Cover your mouth and nose while you're sneezing or coughing. Clean your hands, because many a times we do sneeze and we touch the secretions are on our hand, and we use these hands to open the knob of a door, handle door, or anything, and that place can be infested with that virus. And if somebody else touches it, and that virus can be transmitted to other person, and that can lead to spread of infection, although you may not have sneezed directly in front of a person. So avoid touching your nose, ears, eyes, or mouth when you're having this infection, because you may spread this by touching the various objects in and around you. And practice other good health habits which help in preventing the flu, that is getting plenty of sleep, be physically active, whatever you can do as per your physical ability. Manage and drink plenty of water and nutritious food. Many times patients do come to us saying that we should avoid such things. Except for cold stuff, there is no major restriction on the food. Apart from what you have a restriction as per your diabetes or hypertension, there is no specific restriction in respiratory or any viral illnesses. In fact, you should have good amount of food. People also have this myth that they should avoid dahi, or they should avoid certain fruits. But let me tell you, fruits are nutritious, are the most important, factors in building our immunity. They contain vitamin C, which is an important source for infection prevention. At the same time, they give a lot of fluid to us. So consumption of fruits is not to be avoided in viral infections. Other infections which I just want to briefly touch among during this monsoons is the waterborne infection, which is generally spread by fecal-oral route. which is by the transmission of contaminated food or contaminated water. And most of these diseases which are common in monsoons are the diarrheal diseases, and among them the common is typhoid and cholera. There could be hepatitis, which is generally presented as jaundice, and another infection which you would have known about is leptospirosis, which is common and which is spread by waterborne. So typhoid, again, I'm not going to go into the deeper part of it. Again, another disease, cholera, typhoid. The presentation of basically typhoid is it's a highly communicable disease. It is caused by a bacteria. It can remain in the gallbladder for a long period of time, even if after it's cured. So proper cure of typhoid is must. And the most common symptom of this disease is prolonged fever, severe pain in abdomen and headache, which may indicate towards this diagnosis. So it should be isolated in case if there is a typhoid, and most important, getting a vaccination. Now it is a vaccine preventable disease. So vaccination is available in India. So typhoid is something which can be avoided. In case if you get an infection, start the treatment. In simple blood test or a stool examination can identify the presence of typhoid infection. Other infection which is common in monsoons is cholera. Not very common, but yes, it can lead to severe diarrhea, which would be like watery stools, and the most common symptom of cholera. It is life-threatening disease which can occur in monsoons. It can cause severe dehydration and rapid death. Early recognition and treatment is must for survival. Vaccination available but not commonly used. The prevention is the key for most of these waterborne infections. Third infection which we can get in monsoons are jaundice, and jaundice is basically yellowish tinge to the eyes and skin, and it is generally caused by this hepatitis virus, which the most common among is hepatitis A or hepatitis B, which is spread by contaminated food or water, and flies are a major cause of spread, which are common during monsoons. It can also be spread by direct contact of the patient, but more common is through the contaminated food or water. The symptoms are similar to flu. As I said, the symptoms can be masquerading like any other flu, a high fever together with headache, pain in joint, followed by development of yellowish discoloration of the eyes, and that is what a jaundice is. The jaundice is a symptom. It can be because of many causes. It could be associated with an infection, it could be associated with inflammation, or any other issue which involves the liver. Here again, complete bed rest, identification of the cause, and treatment is very, very important. If it is hepatitis, it is easily preventable by vaccination. Luckily, as we can see in our country, the universal immunization program includes vaccination for hepatitis B nowadays. But whereas for hepatitis A and hepatitis B, there is hepatitis A, not everyone takes, but people who are into the food industry, they are advised or they are mandated to take vaccination for hepatitis A and hepatitis B. Again, third infection, which is very common in monsoons, is acute gastroenteritis, which involves an infection of the gut, and that can lead to severe diarrhea. It can cause dehydration. The most common cause of infections in monsoons is generally a viral infection, but if it prolongs for a longer period of time, it can lead to, there can be associated bacterial infection, and use of antibiotics is what is recommended. But again, as I said, in monsoons, one have to remember that you can get a viral infection of the respiratory tract. You can at the same time get a viral infection of the gut as well, and which can present like any acute diarrhea. So most important treatment in such time whenever you're having diarrhea is to have water replenishment in the form of ORS. Again, those who are diabetics, those who are having some issues with in terms of heart disease, their fluid restriction is there. You have to make sure that the water intake and the use of glucose-based fluid has to be under consultation with the doctor. If severe disease where there's loss of, sweating, there is hypotension, the blood pressure is low, heart rate is very high, severe loose motions, inability to eat, is the time when this means that you have to get admitted and start with IV treatment. Again, leptospirosis. It is a very common monsoon disease, especially in areas where there is poor sanitation, there is a improper drainage. The most common symptom being fever, headache, joint pains, and there is a strong history of a person wandering or wading into dirty water. So that there was an epidemic which was there in Mumbai previously in 2005, 2006. But luckily, the number of leptospirosis have come down. So important history in this monsoons is avoid going in, wading in the water. If there is waterlogging, prevent, if possible, not to go. And if there is no way that you can avoid it, make sure that in case if you get fever after that, please be vigilant about it, that you have not got leptospirosis. A simple test can diagnose leptospirosis and it's very easily treatable. It's not something which is untreatable. Again, so basically prevention of various vector-borne diseases, especially waterborne diseases, is use safe drinking water access, personal hygiene, hand washing techniques, well-cooked food hygiene in terms of well-cooked food, avoid raw food. I see a lot of people eating fruits, thinking that eating fruits is healthy. Yes, but eating fruits outside, which is there available, which is cut by someone I don't know, and it's kept in open where there are flies over it, it is definitely not healthy. It is like inviting a disease. So avoid raw food items which is cut outside. If you want to eat a fruit, eat fruits which have got a peel, so you can peel and you can eat that fruit. Otherwise, it is important to have fresh fruits after they are they are cleaned well. Otherwise, there is a very high chance that you're going to get some other gastrointestinal infection. Vector-bornes are again very common during this season because there is a surge of vectors. Vectors means these are insects or any other animal, insect, or object which acts as a transmitter for diseases between one person to another or between one organism to another. So examples of vector-borne diseases are malaria, dengue, and chikungunya, which are very common during monsoons. And these are mainly spread by these vectors, and they are mostly insects. Malaria, most common disease which is seen in rainy season, and it is spread by a female Anopheles mosquito, and it is very common in India. And in India, it is a dangerous disease, and it has recorded number. The number of deaths which are attributed to malaria is very high. It is one of the biggest killers in the history of mankind. The most important symptom is fever at regular intervals, which is associated with shivering and with muscle pain and weakness. If that is the case, and there is you find that there are mosquitoes in and around you, then possibility of a malaria is there. Early diagnosis and treatment is very, very important, and it is curable. You can treat it. Only thing is you have to identify it early by a simple blood test where you can check for malaria antigen or a malaria parasite in the blood. The symptoms can be vague. They can be from headache to fever to body pain, chills, dry cough, enlargement of the spleen and stomach, vomiting, nausea. Again, treatment of malaria, it can be easily treated on OPD basis. At the same time, if there is severe malaria where there is involvement of multiple organs, there is difficulty in breathing, there is bleeding from anywhere, there are red spots on the body, that is a time when one should get admitted in terms of malaria. Simple way is to prevent malaria is to create awareness about recognizing malaria by identifying the symptoms. Second, bite prevention using mosquito nets, preventing the breeding of mosquitoes, and early diagnosis and treatment have a long way to prevent this menace of malaria. Again, dengue is similar to malaria, but caused by a different mosquito called Aedes mosquito. It is a mosquito which bites during the day. And it lays its eggs in clean stagnant water. That's why it is very important, especially when we are living with pots, or there is a place where there is waterlogging. Clean water, that is a place where these mosquitoes will breed. Again, symptoms are similar here. The symptoms which are classically associated with dengue is a severe body pain, severe joint pain, headache. It is in fact the other name for dengue fever is break bone fever. You get this kind of pain as if somebody is breaking your bones. So it's a severe disease. One has to understand that one can progress to a severe dengue if not identified and treated. Well, the treatment, the clinical symptoms are similar, like any fever, but headache, retroorbital pain, body pain, and all those things are there. Again, one has to understand that there is no specific treatment for dengue as what we have these anti-malarial drugs, but the most important treatment is hydration and identifying. If there is worsening of symptoms, you have to immediately rush to the hospital and get admitted so that hydration can be initiated. Chikungunya, again, a very morbid, not a dangerous disease, but it does affect quality of life. It is again spread by the same mosquito, Aedes aegypti mosquito. It's a self-limiting disease, but it can lead to a lot of morbidity in terms of severe joint pain lasting for months together. So basically, vector-borne diseases, the most important aspect is prevention, where we avoid the bites, the use of nets, repellents, adequate clothing, avoid high-risk areas where there could be mosquitoes, and prevent the breeding of vectors and early diagnosis and treatment. Some of the fungal infections which are common generally because of the moist environment, nail infections, skin infections are very common. Early identification, wear cotton clothes, loose clothes, keep body dry, use a talcum powder which has got antifungal properties, and visit a skin specialist when there is non-resolved. So this is an overview of infections which we generally get in monsoons. Although my topic was related to cough, but I thought that it is at a time that we can discuss about everything which one can get in these monsoons.
Thank you very much, Doctor. Thank you very much. And thank you for expanding the scope of this. We obviously looked at cold and cough, but it was great that you also looked at other monsoon related issues as well. We have a few questions that have come in. This is from Mr. Jammunathan, who's 77 and he's from Bangalore. He asked, can taking vaccine for the pneumococcal vaccine prevent common cold? And also there's a question from Sarita Agarwal about taking the flu vaccine. Can we use that?
So this is a very important point which has been raised. So vaccination prevents many infections, and vaccines are pretty safe. That is first thing which I would like to tell to the audience, that vaccination is an important tool in preventing infections. It's a preventive strategy. It is not a treatment strategy. Now, vaccines which are available for flu. So there are vaccines which are available for flu, which is the influenza virus, which is common cause of infection in this season, not just this season, all throughout the year. And it has got high mortality, especially in elderly population. So there is this vaccine which is available called flu, which is quadriflu, which is every year there is a strain of this flu virus changes. So the CDC, that is which is a US based body, and they keep on revising this, which flu virus is prevalent in that year, and they keep on refining these vaccines. So every year it is recommended for people who are elderly, more than 60 years of age, in infants or in children below 5 years of age. The influenza vaccine is recommended. It's a single dose intramuscular vaccine to be taken before the onset of monsoons. In the West, they take it at the time of September, where there is spring or winter season which starts. So generally, once a year vaccine for flu, which is called a flu vaccine, it has to be taken every year, especially recommended for elderly population and younger population who are prone to develop severe flu infection. Now, second vaccine which has been asked for is pneumococcal vaccine, which is a vaccine for pneumonia. Now, that is a bacterial infection, and that is the most common cause of pneumonia. So it is recommended for, not for all, only for high-risk individuals like people who have underlying diabetes, people who have underlying liver disease, kidney disease, and in elderly population more than 65 years of age, who are prone to get a severe pneumonia infections. They are supposed to get this pneumococcal vaccine, which is in the dosage schedule to be taken once every 5 years as a booster dose.
All right. Doctor, so, the monsoon has already set in. Is it an okay time to take it? And the question which is being asked, I've got it from on my mobile, is are there any precautions to be taken after the injection is taken? Because after one took the COVID vaccine, there was some fever. Could that happen? Because one needs to plan out one's program accordingly.
Yeah. So these vaccines, one has to remember that for flu vaccine, what are the recommendations for elderly population aged more than 60 years of age? A flu vaccine once in a year. Second, pneumococcal vaccine to be taken once, and then the booster dose comes every 5 years. That is for the recommendations for elderly to prevent these two major infections, which are respiratory infections. One is flu, which has to be taken every year. Whereas the pneumococcal vaccine, you have to take the booster after 5 years. These are the two recommendations. Now, what are the side effects which can be associated with vaccines? Any vaccines, be it flu, be it pneumococcal, it can lead to fever for a day or two. Most of the times it is not serious. If you get fever, you can take a paracetamol and it subsides in the next 1 or 2 days. There is no major side effects, but yes, theoretically, there are known side effects associated with vaccine, but again, they are not very common.
Right. Thank you, doctor. We have a question from Mr. Anil saying, what is seasonal affective disorder in monsoon? How does one
Yeah.
prevent it from affecting mental health?
Yeah, so seasonal affective disorder is basically because of the gloomy nature which happens during the monsoons, because of lack of sunlight. There is an increased incidence of depression, especially in those people who live alone, especially in elderly population, and in people who are prone for some or the other depressive disorder. So again, due to the seasonal variation, because of the lack of sunlight, because of the gloomy nature of the weather, that can affect the mental status of a person, especially those who are living alone. And so it is very important, when this kind of weather is there, you should have a company, you should spend time, talk to people, talk to your friends, spend time together, so that you can prevent the loneliness and the effect of the weather on your mind.
Right. Doctor, we have two questions on hepatitis B, which is how do we avoid hepatitis B, from Asha Jamkar, and from Gyan Chandra Shukla. He says, if one has suffered from hepatitis B, should we take a vaccine for it, or will it have antibodies for the antigen?
So good question. Again, hepatitis is a viral infection which affects the liver. There are 4 different types of viruses: hepatitis A, B, C, D, and E. D is not so very common, but A, B, C, D, A and E are spread by food. There is no vaccine. There is no such vaccination required for everyone who's having hepatitis. As I told you, there is no specific vaccination recommended for everyone. But those who are in the food industry, or those who are travelers, or those who are working in hospital industry, those who are prone for severe infection, they can take hepatitis A vaccines. Hepatitis E, there is no vaccine. Hepatitis B, there is a vaccine which is available. There is no vaccine for hepatitis C. Now, hepatitis B again is a bloodborne. It's spread through blood. It's spread through needles or through blood transfusion. So again, hepatitis B, there is a vaccination which is available, which is part of our universal immunization program. But our generation, or the generation which is older to me, this was not a recommended hepatitis B program in our universal immunization program. So as a medical professional, we have taken hepatitis B because we deal with patients, but it is still not recommended for everyone, because it is not until unless you have a chance of getting infected where you are dealing with blood or blood products. That is the only way where you can get hepatitis B. Now, who should get the hepatitis B vaccination? People who are at risk of getting a hepatitis B: healthcare workers, hospital industry workers, veterinary workers, or people who are involved in somewhere with patient care, or people who have a family member who has got hepatitis B. They should be vaccinated. That is one thing. If you get an infection, what are the complications? Generally, if you get the infection, it is a chronic infection. It can lead to liver failure or cirrhosis of liver later on. It generally does not cause any acute thing. If you have got hepatitis B, should you take a vaccination? Most of the time, the body produces antibodies, and those antibodies are protective in nature. So as such, you won't be required. But if you have an acute infection, there is treatment which you should be taking for hepatitis B, depending on the symptoms. If you have got severe symptoms related to hepatitis B infection, there is treatment available to suppress or to kill the virus, so that you don't have any complications with hepatitis.
Right. Doctor, this concerning hepatitis, there's Rani Shekhar who says the injections are not available. It's out of stock. I don't know which city she's calling from, she's messaging from, but is that something which is there?
The
shortage?
vaccines?
She's yeah, she's from Mumbai.
No, I think so. We have Engerix B, and all those vaccines are easily available.
All right, fine. If you do have a problem, then do reach out
Visit
to
your doctor.
yeah.
Visit your doctor. He would definitely ask you, if a particular brand is not available, probably he will ask you to get another brand which is available.
Doctor, so if a person is, you mentioned about blood transfusion. So if a person is required to take blood transfusion for, if hemoglobin thing goes down, so is it good to take a hepatitis vaccination for that?
No, ma'am. See, the transmission is through blood. So the blood which is transfused is regulated, and most of the blood products, if it is they are protected or they are tested. Whoever donates the blood, that blood which is collected is tested for these transmissible infections that includes hepatitis B, hepatitis C, HIV, malaria, and there are these diseases which are checked in that blood, and then only that blood is transfused. That blood bag which is tested for negative for these, and that is the only blood which is provided. So the risk of transmission from a blood bag is very less, because these blood which is stored or which is in the blood banks are tested for these transmissible infections. And if they identified, that blood is discarded.
Doctor, now supposing a person does have cold and cough, just a sneeze or a persistent cough which may last for beyond a day, or a throat infection, what does she or he do? Just pop a paracetamol, take a cetirizine, take an Allegra, one of these antihistamine. Rest. What is, because obviously for something like that you may not want to connect with the doctor.
Yes, you're right.
So what sure is the first first port of call, first remedy, home remedy that one can look at?
Yeah. So most of the times, as I told you, these infections are self-limiting. Respiratory infections, the cough, cold, which is generally seen, they are viral infections. Most of these are self-limiting. They don't cause any major illness until unless they persist for a long period of time. For example, if I get cough, cold, and it is not resolving the next 4 or 5 days, it is becoming more and more, my fever is not settling, I am finding more and more difficult to remain normal, then obviously one should go to a visit to a doctor. But otherwise, at the start of the symptoms, don't pop an antibiotic. That is the most important thing. And the most common antibiotic which is abused by everyone is tablet azithromycin. Everybody pops up AZ immediately the moment they get cough or cold. So please stop taking any antibiotics. You can take paracetamol. Paracetamol will give you relief. Take it on an SOS basis. Home remedies like avoiding cold water, using turmeric, or which are age-old remedies of our home, having turmeric, haldi, doodh, and all those things that you can start. If you have flowy nose, you can take Allegra or levocetirizine, which you have at home. Yes, but again, remember that if the symptoms are persisting for long, then you should visit a doctor. Most of the times, it will subside in the next 2 to 3 days.
Doctor, what about, you mentioned about haldi, doodh. Is that something that one must, take it for a prolonged purpose for the entire monsoon, or is it only like an SOS?
No. Nothing should be taken for long, be it Ayurvedic, be it anything. Having milk is fine, but not everyday turmeric. It is not something which is, you should take it on an SOS basis, because turmeric, again, overconsumption of turmeric is associated with other medical issues. So I would advise, it is my personal advice, that, it's not something which is, what is going to prevent is your immunity, and how to build your immunity is to have a good sleep, is to have a nutritious diet, is to have a regular physical activity. These are the 3 most important things which build up your immunity and which will prevent from any infection.
Right. Talking about nutritious diet, doctors, there's somebody who said that, in this rainy season, consumption of oily food like pakoras or bhajiyas, as we call it in Bombay, increases. And is that a cause for throat infection? Should one just indulge in it once in a while? What would you advise?
Yeah, so there is no direct relation. People say that, consumption of most of the times family members, they say, hamare ghar mein, especially our mothers or grandmothers, tel ka khaya to gala, ye ho gaya. That is a very common this thing. Yes, you should avoid oily, because oil is not good. Once in a while, okay. But again, as per your health status, one should avoid. Overall, a blanket statement, it would be that oily stuff or deep fried things is not only just injurious for for the health, but it can in the long period of time, it will lead to high cholesterol. It will lead to cholesterol issues, liver issues, fatty liver, and all those things. So one should avoid as much as possible these things. Once in a while, if health permits, I would not say no, but yes, preferably avoid oily stuff.
After one last question from Bomi, who says, Doctor, is it true that we can get a cough due to pollution, which is rampant in a city like Mumbai?
Yeah. So again, a good question, because cough is not necessarily, cough is, again, as I told you, fever is a symptom. It's not a disease. Similarly, cough is a symptom. It is a protective reflex. So anything our body protects, if there is an injurious thing, or if any outside stuff which is not good enters into our lungs, the lungs expel it. So it's a way to expel that. So cough is a protective reflex. Again, the cough cannot be all the time infectious. The cough can be because of so many other things like inflammation, or it can be because of pollutants. For example, I go into a dusty environment and those dust enters into my mouth or in my respiratory tract. Obviously, my body would, respond by giving a cough. So cough can be aggravated by pollutants, and it is more so common in people who have allergies, like for example, those who have asthma or COPD. They are the people who get a lot of cough, and you can see the incidence increasing during Diwali when there is a lot of pollution or they smoke. So again, yes, pollution can lead to increased cough.
Doctor, even as we close, any word about COVID? In the last week, we've been asking questions to our doctors who've been coming. Should people continue to be wearing masks while going out? What is the status?
Yes. So again, COVID, yes, definitely there has been a surge in number of cases of COVID, and not just COVID, but other flu infections also in the last few weeks or so. But we have also seen that. A cautionary advice to everyone that not just COVID, for any viral infection, the way to protect or to prevent is to wear a mask. A simple cloth mask will do most of the times. Avoid crowded places. And if you are sick, make sure that you don't mingle with people. That is few things which one should do. Now, looking at the COVID or telling about the COVID, what this COVID is, well, most of the times it is a mild infection. It has mutated to a state where it is not a very serious disease. But again, every individual is different. How he's going to react to an infection is different. So people who have an underlying diseases, elderly population should be more cautious about symptoms. If they get symptoms, if the symptoms are severe, if the cough is severe, the fever is severe, the things are not resolving, there is sense of breathlessness, then you should definitely visit a doctor and get yourself treated for it.
Thank you very much, Doctor, for all your time and for an amazing presentation. Thank you to the team at SL Raheja and Fortis to facilitate this. And to all of you here, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Thank you very much,
Thank
Dr.
you so much.